Hey guys, so this is my first music therapy blog post, and well, it's not my first one, but it's my first video blog post. So I have heard from a lot of people freaking out about proficiency, and as someone who went through that a year ago, I can't believe it's been a year, but it has, I wanted to just give a couple pointers and a couple things about what I've learned, and one big thing that that the professors told me in proficiency that has come to be at the hospital setting. So some of the things that I have learned so far, especially about repertoire, is make sure you learn repertoire specific. I printed out a lot of songs and learned a lot of songs that I'm really not using because they're not specific to kids. Kids, simple repetition, 2 to 3 chord songs, Twinkle Twinkle Little Star, If All of the Raindrops Were Lemon Drops and Gumdrops. Kids songs, that's what they need. You're going to use more diverse songs with your teenagers. You're going to use some popular songs too. Taylor Swift, One Direction, those are very easy to learn. They're 2 to 3 chord songs. One Direction songs are basically 1, 4, and 5. The Beautiful song, That's What Makes You Beautiful, it's 1, 4, and 5 the whole way through. They're very easy to learn, and you will get requests for those probably if you're going to be working with any age kids from probably elementary up through high school, even developmentally delayed young adults. Probably listen to that. But the one big thing that I wanted to share was about the voice. So I'm a mezzo. I have a very big voice. No pun intended. Please don't make any jokes. I have a loud mouth. So one of the things that they told me is that you can't sing like you're performing a mezzo role. You have to take it down. So I have some babies, and I do a lot of different songs with them. I do some lullabies, some kids songs, and some popular songs. You just change it up. It's all about the ISO principle. That's all about what it is. So the first one that I'm going to do, it's the Alison Krauss song, If You Say Nothing at All, and that's a really good one to do with babies, especially if there's parents there, because that song, it just touches the heart. So first I'm going to sing it as if I was like in full voice, and then I will go back through and sing it in a bedside manner. So I want you to listen and keep in mind when you're doing your proficiency that the professors, they want you to sing loud, they want you to project, they want you to be on pitch, have correct intonation and tone, but they also want you to keep this in mind. All day long I can hear people talking out loud, but when you hold me near, you can drown out the crowd. Try as I may, I could never explain what I hear when you don't say a thing. The smile on your face lets me know that you need me. There's a truth in your eyes saying you'll never leave me. Touch of your hand says you'll catch me if ever I fall. Well, you say it best when you say nothing at all. All day long I can hear people talking out loud, but when you hold me near, you can drown out the crowd. Try as I may, I could never explain what I hear when you don't say a thing. The smile on your face lets me know that you need me. There's a truth in your eyes saying you'll never leave me. The touch of your hand says you'll catch me if ever I fall. Well, you say it best when you say nothing at all. So that's just one example. Another thing is that one song, the song that I use a lot with both babies and like 3-4-year-old, that really fun toddler preschool age, is If All of the Raindrops Were Lemon Drops and Gumdrops. And that's normally a very fast song. If all of the raindrops were lemon drops and gumdrops, oh what a rain that would be. We'd stand outside with our mouths open wide and sing ah 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 ah. You get the point. So for babies, if all of the raindrops, lemon drops and gumdrops, oh what a rain that would be. Oh, we'd stand outside with our mouths open wide and sing So, once again, it's the as a principal with a baby. You want to be there, you want to be singing, you want to be soothing. Yes, you want to be stimulating, but you don't want to scare them. You don't want them to cry. That's the opposite effect of what you're trying to get them to do. Most of the time you're trying to get them to, if they're fussy or if they're awake, you're trying to get them to sleep so that they can grow, especially if it's a NICU baby, or if they're agitated. I think that's all. Guys, if anyone has any questions, message me on Facebook or send me an email. Y'all know my TW email address. I'd be more than happy to help and answer any questions that you might have. I may not know them. Let me leave you with one more pointer. Don't be afraid of messing up, especially if you're with kids or in any type of medical setting and any patients or clients. They don't care. They're just glad that you're there to listen. It's a different type of therapy. It's a fun. Keep on going. You know, I messed up in the video, and it's fine. It's just, if it's your passion, just keep on going, and don't be afraid. Actually, don't be afraid to mess up, which is very difficult for me. But don't be afraid to mess up. So let me leave you with that, and I'll see y'all next time. Thanks.